I see trees of green, red roses too. I see them blue.
Welcome to Childhood Cancer Talk Radio, powered by Jack's Angels, where we talk about your experiences, advocacy news, research, and today's heroes for kids. We are here to bring hope to the unthinkable but real experience of a child diagnosed with cancer. Jack's Angels' advocacy mission is to provide a voice for children with cancer to effect change for a more hopeful future for those to come. Childhood Cancer Talk Radio starts right now. Here is your host, Janet Demeter. Welcome to Childhood Cancer Talk Radio on TogiNet.com. I'm Janet Demeter, your host for this, our 37th show already. Wow, in our first year on the air. And we are pleased to present to you a forum for discussion, camaraderie, advocacy for those in the childhood cancer awareness community, and also for you to launch new ideas, programs, and exciting developments in research and treatment, and certainly share your hopes for pediatric cancer research with Vice President Biden's Moonshot Initiative. We offer this for patients, families, caregivers, clinicians, advocates, and industry professionals to voice your concerns and or promote your agenda as it may help our listeners seek solutions and or connect with others. We are an international show produced here in the United States at TogiNet headquarters in Tyler, Texas. I come to you mostly from little old Agua Dulce, California, home of Jack's Angels Foundation for Pediatric Brain Tumor Awareness and Research and Advocacy for Children with Cancer. Last week, we had Dr. Raphael Rousseau with Genentech discussing the latest technological innovations being applied to pediatric cancer research. And in our near future, we have for you Jamie's Journey, Cancer from the Voice of a Sibling, a new book being launched by author Sharon Wozni of Indiana, and then Caitlin Lee, a strong teenage girl facing a rare and frightening diagnosis with BPDCN leukemia. And then finishing the month this October, we'll hear from Dr. Miriam Fulati, top researcher at Cincinnati Children's Hospital. She'll be talking with us about her work with DIPG, a common pediatric brain tumor with an extremely poor prognosis, but which sits amidst exciting scientific and data organizing progress on that front. We check in often with DIPG research as it represents an opportunity to raise awareness for the urgent need for pediatric cancer research funding, and also to confront more than one frontier of our current scientific understanding. But the real story and excitement today is about quality of life and pain management for children with cancer and other chronic illnesses. Our distinguished guests visit with us today from Canada. Dr. Christine Chambers at the Center for Pediatric Pain Research, at the IWK Health Center in Halifax, Nova Scotia, and Dr. Jennifer Stinson comes to us from the Hospital for Sick Children in Toronto, Ontario, Canada. Both are involved with a project called Making Cancer Less Painful for Kids, which is #KidsCancerPain, a social media campaign for parents, by which they hope to address the difficulty of pediatric cancer pain, what causes it, its common myths, how to assess it, how to treat it, and more. Both of these women are highly accomplished academically and clinically speaking. First, Dr. Chambers has written over 100 peer-reviewed publications on the role of developmental, psychological, and social influences on children's pain, with a current research focus on the role of families in pediatric pain and social media for health knowledge mobilization. Her work spans knowledge generation, knowledge synthesis, and knowledge translation, which is policy and public outreach. Dr. Chambers is the principal investigator of the It Doesn't Have to Hurt social media initiative in partnership with Eric M's Yummy MummyClub.ca and funded by the Canadian Institutes of Health Research, as well as the Making Cancer Less Painful for Kids, or #KidsCancerPain campaign, in partnership with the Cancer Knowledge Network and funded by the Canadian Cancer Society. She is the 2016 recipient of the American Pain Society's Jeffrey Lawson Award for Advocacy in Children's Pain Relief and the Canadian Pain Society and Canadian Pain Coalition's Pain Awareness Award. Dr. Chambers was identified as one of the top 10 most productive women clinical psychology professors in Canada. She's also a mother of 4. My hat is completely off to her. Dr. Jennifer Jennifer Stinson is the Mary Jo Haddon Nursing Chair in Child Health and an advanced practice nurse in the Chronic Pain Program at the Hospital for Sick Children in Toronto. Dr. Stinson's clinical work focuses on working with children and youth in chronic pain and their families as part of an interdisciplinary pain team in the Department of Anesthesia and Pain Medicine at SickKids. Her major clinical research interests are in the area of pain and symptom management and the use of e-health and mHealth, or mobile phones technology, to improve the assessment and management of pain and other symptoms in children with chronic illnesses. She is also interested in developing and evaluating novel interprofessional pediatric pain curricula for healthcare professionals. And Dr. Stinson, I must read your accolades as well, because they are many. In recognition of her important work in the area of pain, disease self-management, and e-health, Dr. Stinson has received a Career Scientist Award from the Ontario Ministry of Health and Long-Term Care, that was 2009 to 2011, the Canadian Arthritis Network Investigator Award from 2011 to 2013, and the Top New Investigator Award in Canada, the Peter Lougheed CIHR New Investigator Award 2013 to 2018. She also received the Canadian Pain Society Early Career Award in May 2012 and the International Association of the Study of Pain Childhood SIG Early Career Award in June 2015. Without any further ado from me, it is my great honor and pleasure to introduce these amazing doctors and great ladies to you. Dr. Chambers and Dr. Stinson, welcome to the show.
Thanks for having us. It was a very kind introduction.
We're delighted to be involved.
Well, perhaps you could both start by telling us about this, and I've been using it already, the hashtag Kids Cancer Pain campaign.
Sure. I'm really happy to tell you about this project that Dr. Stinson and I are collaborating on. Dr. Stinson's a nurse. I'm a child psychologist, and we have both been studying children's pain for a very long time and working with children and families who have pain. And a couple of years ago, we started talking about the importance of needing to raise awareness about children's cancer pain, how we can better assess it and manage it. And I had been using social media in some other work, and we put together this grant to partner with the Cancer Knowledge Network, which is North America's most widely read online education resource about cancer. Partnered with them in a proposal to the Canadian Cancer Society to develop this social media campaign and to evaluate it. And really the whole point of the campaign is the fact that we've come a long way in the last 20 to 30 years when it comes to cancer pain management in children. And in fact, I would say cancer, pediatric cancer, was really one of the first areas to appreciate the importance of pain management, whether it's pain from procedures, pain from disease, pain from treatment, and increasingly we're learning more about chronic pain developing in cancer survivors. And so we still need more research, and we'll talk to you about some of the other types of research projects that are underway in the area of pediatric cancer pain later. But the problem we're trying to address is that we already have a lot of great research evidence, a lot of great evidence-based strategies to help children with cancer pain and their families. But we have this, what we call a knowledge to action gap, where we have this scientific knowledge, but it tends to sit in the, medical journals and the medical conferences. It doesn't always find its way to families. So that's really what we're trying to address here with this campaign.
This is a very naive question, but is the pain that the children usually deal with, is it more from the treatment, or is it more from the actual organic disease that causes the pain, or is it a mix?
There have been studies, and in fact, the first part of our campaign over the last little while has been really educating parents about that, like what are the most common sources of pain in cancer. It really comes from all of those things. Procedures are very commonly identified as sources of pain. It's also the treatments and sometimes the disease itself, or often the disease itself. I don't know, Jen, if you want to add to that based on your experiences and your research.
I just remember, the relief and happiness for my little boy when we would go to a non-owie doctor. That's all I remember. It was such, the pain issue was often such a source of either, it not being there, being a huge relief, or a source of happiness, or, if the pain was coming, it was really hard. It was hard for all of us. It was hard. I mean, goodness, even going to the pediatrician and having to have a child get a shot, for me, was traumatic. I know that some of these procedures that these children endure, and for me personally, and for the people that I've met with, mostly it's been, I wouldn't say my area of experience with it has been limited, but it has been to a certain extent. So what I've heard from others is, especially with the blood cancers, is pretty horrific. And so I can only imagine, these long extended treatments, and sometimes the children enduring these treatments and for a long period of time can be, incredibly difficult for the family unit entirely, and for relationships they're in.
Yeah. Yeah, Janet, you raise a good point. I think it's, these procedures can be painful, but there's a lot of anxiety related to them. So it's not only managing the pain, but the associated anxiety that these children have about these painful procedures and treatments, and then finding ways to help reduce that anxiety as well as the pain.
Yeah. And the anxiety, of course, makes the real thing sometimes all the worse.
Exactly.
I'm going to just quickly here, you're listening to our conversation today with Dr. Christine Chambers and Dr. Jennifer Stinson. They are both coming to us from Canada today, collaborating on the hashtag Kids Cancer Pain Project. And we're live right here on Childhood Cancer Talk Radio. For more information about the project, please visit the Kids Cancer Pain website at cancerkn.com/Kids Cancer Pain. I'm Janet Demeter, your host, encouraging you to stay tuned as we take a quick break for these messages from our TogiNet sponsors.
Stay tuned. Janet will be right back with more on Childhood Cancer Talk Radio, where kids come first for the cure.
In today's business world, a helping hand or idea that doesn't come with an invoice is a treasured find. And if that happens to you, then you need to pay it forward to keep other entrepreneurs from making mistakes or getting a raw deal. It's called Paying It Forward with Josephine Girassi, Wednesday mornings at 10, 9 a.m. Central. Josephine is going to have the guests describe their accomplishments, the lessons they've learned, both good and bad, and then sharing those pieces of knowledge as we create a movement of paying it forward. For more information about Josephine, her business, and background, you can go to mymomknowsbest.com. Josephine Girassi has always been a problem solver. She saw this need and has turned it into a movement. It's Paying It Forward, with tips, tools, and advice, and hard lessons learned. These pieces of knowledge can make a huge difference for you, your business, and others. So join us for Paying It Forward with Josephine Girassi, Wednesday mornings at 10 a.m., 9 a.m. Central, on TogiNet.com.
LinkedIn. It's a great tool and a great way to do business in today's social media driven world. And Carol McManus is the LinkedIn Lady with the LinkedIn Lady Show. Tuesday and Wednesday afternoons at 4 p.m. Eastern on allbusinessradionetwork.com. The LinkedIn Lady Show is designed to inform, inspire, and educate businesses. Every social media site has a specific demographic, personality, and purpose. And the LinkedIn Lady will interview a variety of guests, such as business owners who can showcase their business and talk about how they use social media, such as Facebook, Twitter, YouTube, Google+, Pinterest, and of course, LinkedIn. For more on Carol and the show, info, check out our website, LinkedInLady.com. As trends change and new applications become available, the LinkedIn Lady Show will bring that information to you in an easy-to-use, fun, and engaging way. Every Tuesday and Wednesday afternoons at 4 p.m. Eastern, it's the LinkedIn Lady Show with Carol McManus on AllBusinessRadioNetwork.com.
Welcome back to more great conversation on Childhood Cancer Talk Radio, because every child's life deserves hope. Here's Janet.
Welcome back to our show today. I'm Janet Demeter, your host, bringing to you live our distinguished guests, Dr. Christine Chambers and Dr. Jennifer Stinson, talking us today about the Kids Cancer Pain Project using the hashtag KidsCancerPain. You can find more information about the project on the web at cancerkn.com/KidsCancerPain. But to Christine and Jennifer, before the break, we were discussing the anxiety that children can experience who are going through cancer treatments. Sometimes the cancer itself causes undue pain, but the anxiety of anticipating, I think, the pain of treatment or pain increasing. What research have you uncovered or developed that is showing some possible avenues of support for this?
Right. I mean, you raise such an important part. Sometimes the anxiety about the procedure, the anxiety about the pain is worse than the pain itself. And, studies have shown that. And it's not just the child's anxiety that comes into play. It's also the parent's anxiety. And parents want to be able to help and support their children. I mean, I have never met a parent who, regardless of their child's diagnosis, didn't want to be able to be helpful. But often as a parent, you just don't know what the right thing to do is. My research over the last 20 years has really focused on the role of parents, what families and parents can say and do, and how that impacts their children's experiences of pain. And, that's really sort of what we're hoping to capitalize on in this social media campaign, is that when parents are given the right information, about how to approach, say, their child's medical procedure, how they should best prepare their child, whether it be psychologically or, pharmacologically. We have members of our parent panel who, it took them quite a while to discover, often by sort of a chance encounter with a health professional, that there are topical anesthetic creams that you can apply to your child's skin before a painful procedure that significantly reduce pain. So when a parent has the right information, they can use that in a way to advocate for their child. And I mean, I believe no one will advocate more strongly for a child than a parent. Parents are common denominators to almost all of their children's medical experiences. And so it makes sense to give the parents the evidence-based information. And we're doing that over social media, a way that is very comfortable and accessible for parents. If they're on Facebook, if they're on YouTube, if they're on Twitter, just by following our hashtag, they're able to access content that's been vetted by experts, that's been woven into blogs, and use it with their child in a way that we hope will be helpful.
That's fantastic. How are you tracking how the results for these people, or if it's helping them, or is there an opportunity for them to give feedback?
Right. So there's a couple of levels of evaluation wrapped around all of this. So not only are we creating with Dr. Stinson and our colleagues in oncology from across Canada, creating this content, but we are studying this whole campaign. So we are studying the reach of the campaign. Each piece of content, we know how many people saw it, how many people liked it or commented or shared on it. We also we did an online survey of parents before the campaign started. We had over 300 parents of children with cancer complete the survey over a 1-month period. And then we're going to be revisiting them in the future. Once the campaign is over, it's a 12-month campaign to see, are they more aware of and did they use more evidence-based strategies because of the content? We've also attached a sub-project to the campaign where we're actually using Dr. Stinson's Pain Squad app that I'm sure she can tell you a bit more about to have children directly rate and track their cancer pain using a free downloadable app that she created.
Wow. Everything's an app these days. I'm so glad that there's one for this. That's awesome. Jennifer, could you tell us a little bit about it and how did you start it?
Sure. Well, despite the fact that kids' cancer pain is so common and distressing, there actually aren't a lot of tools that allow us to track in real time what the child's pain experience is like, what the pain is coming from, whether it's coming from the treatment, the cancer itself, or procedures. And so in doing interviews with adolescents, their parents, and healthcare providers, we reached out to them and asked, would an app that tracked these sort of components be useful to both the child, the parent, and the healthcare professional? And everyone unanimously said yes. So over the course of a couple of years, we developed Pain Squad. So this is a tool that's an iPhone-based app that, as Christine said, is freely downloadable, that allows you to track, the amount of pain, where it hurts, what you think that pain's due to, and it asks about the treatments you're using and whether they're effective. And the good thing about this app is that you can generate a PDF and share that with your healthcare provider either before a visit or during a visit to discuss your pain and identify better ways to manage it.
It's genius. Wow. So how have people been using it, and how long have been people using it so far?
Yeah, so there have been about 1,000 people that have downloaded the app and used it, and we've conducted a couple of studies to make sure that it is a reliable and valid tool. And based on the data that we got from the study, where we had 100 participants, adolescents with cancer, use it for a 2-week period, we gleaned some interesting data that despite the fact that these kids are being prescribed things like morphine, et cetera, only 50% of them were actually using it to manage their pain, and very few of the young people were using things like Christine mentioned, like psychological strategies or physical strategies to manage their pain. So that led us to develop a new app called Pain Squad Plus, which not only tracks pain, but based on what the kids enter into the diary, it will provide them with real-time advice on terms of how to manage procedural pain, for example, if they're having a port accessed, or if their pain is more chronic or they're experiencing headaches, it'll provide them with some advice to manage that pain in real time, wherever they are, whether they're in a hospital, at home, or at school.
Oh, that's wonderful. I can see that taking probably a percentage of the anxiety out of the equation already with just having it. Wow. Are there any stories that you can think of that you've, actually heard feedback from that you would want to share with us about it?
So I can talk, because I work as a nurse practitioner in the chronic pain program, we do see a fair proportion of young people with cancer coming in for what's called neuropathic pain, which can be a side effect of things like certain chemotherapy drugs. And we had this one patient come in who was a 12-year-old boy who often had difficulty describing his pain, and so we actually enrolled him in the study for Pain Squad and the Pain Squad Plus app, and he absolutely loved it and actually brought it into the clinic to show us that one of the new medications that we had put him on for the neuropathic pain was actually in fact helping, because we could see how quickly his pain had reduced with this new medication. So he really, really liked it as a way to help better communicate with his chronic pain team.
Wow, that's wonderful. Is he, how is he doing now Do you keep track of these people?
Yeah.
That's great.
Good contact with him. He's actually doing really well right now, and his pain is really well managed. He's back at school.
Oh, that's wonderful. And so for this app, is this also something that's helped or funded in part by the Canadian Cancer Society, or is this through other means?
The Pain Squad Plus app was funded by the CIHR, which is the funding body in Canada, but also Alex's Lemonade Stand.
Awesome.
Helped fund that project.
I hear about them time and time again. That's wonderful. So if someone wanted to get this app, how would they just search Pain Squad? Is that what they do?
Yeah, if you go into the Apple Store, you can get it for iOS, but we don't have an Android version yet. And Pain Squad Plus is not available yet because we've just finished the study sort of evaluating it to show that it actually, in kids that had used it 28 days, they had reduced pain. The pain interfered less with activities of daily living, and it actually improved their quality of life in terms of improved emotional and social aspects.
Wow.
So we hope in the next year or two to make that one publicly available as well.
Fantastic. So I have to stress to our listeners, this is cutting edge information. This is off the presses. So although it's not ready yet for Android, and do you have a projected time when that might be available to people with that technology?
The Android version will probably take us another year to develop.
Another year. Okay. So, sorry to have to plug Apple, but get an iPhone. So
yeah, I don't have stock in Apple.
Okay. We just needed to make that disclosure. No commercial for Apple, but it is handy. So, okay. Well, that's very helpful. Very helpful to know. Gosh. So when did it start? When did you start experimenting with it? We have another minute or so before our next break. Is this recent, within the last year?
My work in terms of apps for kids with cancer has been over the past 4 years.
Wow. Fantastic. Well, I'll be asking you more questions about that after our break. I just want to let people know that we're talking today with Dr. Jennifer Stinson with the Hospital for Sick Children in Toronto, and also with Christine Chambers at the Center for Pediatric Pain Research at the IWK Health Center in Halifax, Nova Scotia. This is all about the hashtag Kids Cancer Pain Project, and we're live right here on Childhood Cancer Talk Radio. This show is brought to you in part by Jack's Angels Foundation for Pediatric Brain Tumor Awareness and Research and Advocacy for Children with Cancer on the web at www.jacksangels.org. Don't go away, and if you need more info about their program, go to cancerkn.com/Kids Cancer Pain.
Stay tuned. Janet will be right back with more on Childhood Cancer Talk Radio, where kids come first for the cure.
It's the Fitness Minute with fitness expert Annette Hammond.
To lose weight, we know that each day we need to burn more calories than we take in through eating, and exercise burns more calories. According to Discovery Health, a 150-pound person will burn about 60 calories while taking a 1-hour nap. 1 hour of sitting and watching television burns about the same. But if that 150-pound person takes a 1-hour brisk walk, then say goodbye to more than 250 calories. Cardio exercise like running, biking, swimming, and brisk walking are the best modes of exercise to burn the highest amount of calories and will get the endorphins flowing in your body. Those feel-good neurotransmitters boost your mood naturally. So use exercise to burn calories, lose weight, and to feel good. I'm Annette Hammond. To hear other fitness and weight loss tips, visit our website at AnnetteHammond.com.
It's words you never heard.
When residents of Alligator Point, Florida, discovered a 400-pound Gaberlunzie bear raiding their garbage, they called the local wildlife authorities. The officers came out and shot the bear with a tranquilizer dart in order to move him. Unexpectedly, the frightened bear swam out into the water, where it started to drown as the tranquilizer began taking effect. Adam Warwick, an officer from the Wildlife Commission, jumped into action, swimming towards a juggernaut bear, while the other officers tried to figure out how to rescue both of them. Adam was somehow able to grab the bear and paddle 25 yards to the shore, saving the bear's life. The bear was then loaded on a truck and transported back to its home in the forest. What's a word for a last-minute attempt to get something done? A charrette.
It's words you never heard.
I'm Carolyn Davidson, and you can have fun challenging your words you never heard vocabulary with my free app, Too Funny for Words.
You'll always have my shoulder when you cry.
Welcome back to more great conversation on Childhood Cancer Talk Radio, because every child's life deserves hope. Here's Janet.
Welcome back to Childhood Cancer Talk Radio. A great show for you today with Dr. Christine Chambers and Dr. Jennifer Stinson with the hashtag Kids Cancer Pain Project on the web at www.cancerkn.com/Kids Cancer Pain. I'm going to review for a brief advocacy report here a few of last month's developments in Washington, D.C., as it was September, Childhood Cancer Awareness Month. It's a big month for all of us. The White House briefing on September 16th was a welcoming forum with primary speakers Dr. Danielle Carnival, Chief of Staff and Senior Policy Director of the White House Cancer Moonshot Task Force, who gave an overview of the moonshot as a call to action to private sector organizations and companies, research institutions, and individuals who came forward in inspiring ways at the June 29th summit. Also joining us was Dr. Doug Lowy, Acting Director of the National Cancer Institute of the United States, who clarified that all types of pediatric cancer are being included in the NCI's Pediatric Match trial, originally hoped to begin at this time, but expected to begin for certain during the first part of 2017. Co-funding of organizations with the NCI was encouraged with enthusiasm, and participation in the National Council of Research Advocates. It was still difficult to get a direct answer to the desire to prioritize NCI research grants for low survival rate cancers and young children, but we were assured that the Office of Advocacy Relations, consulting Amy Goldman, would be an open door, and access to consulting with Doug Lowy personally would be the next possibility after that. After my personal meeting with Patrick Mahoney from the Office of Advocacy Relations and his partner Laurie Sinkin, I was strongly reassured of an ongoing advocacy relationship and open policy for the future of that office that was pretty much unprecedented. The Office of Congressional Relations had actually supplied the language in the DIPG awareness resolution this year, which was a real step forward. It was a collaboration between Jack's Angels Foundation, Congressman Knight, Congresswoman Spear, Dr. Michelle Mongi of Stanford University, and the OCR, calling for more consideration for those low survival rate cancers and years of life lost with the NCI research grant process. It's sort of like the roundabout way of dealing with the 4% uprising, because unfortunately no one will still really talk about it. It is unlikely that the resolution will go through this year, but I was encouraged strongly for its reintroduction, so that's what we're working for. The summit for the Congressional Caucus was similarly hopeful, with a visit from Greg Simon, Executive Director of Moonshot Initiative. He reminded all of us that we are the moonshot as we move forward into a new administration, uncertain of its continuance therein. Congressman Michael McCall of Texas, 10th District, let us know directly that Fred Upton, who is the chair of the Energy and Commerce Committee, where he had promised a vote on the STAR Act before the session is through, which is very good news. We just hope that, that actually happens. Support for the 21st Century Cures Act, Creating Hope Act, Race for Children Act, STAR Act, they were all underlined with the exception, of course, of this awareness resolution at the summit. This is why I went to Washington. I had to advocate for it, where I have a chance to speak for it at the White House briefing, beautifully managed by Faye Jenks at the White House Office of Science and Technology and Public Affairs. There was no public discourse at the caucus summit this year. So there was no like question and answer, no panel. There was a panel of young people and survivors, which was actually quite excellent. But anyhow, coming at the end of this month is CAC2, the Coalition Against Childhood Cancer, their research summit at Cold Spring Harbor, New York, including speakers from NCI and other important research proponents, supporters, advocates, and industry professionals. Registration is open, people, and discounted for CAC2 members, so that's an incentive there for individuals and organizations. Please visit www.cac2.org for more information. So now, thank goodness, we can continue with our conversation with Dr. Christine Chambers and Jennifer Stinson. Before the break, oh my goodness, we were discussing this amazing app that Dr. Stinson had put together called Pain Squad and Pain Squad Plus. It's now, Pain Squad is now available on iOS for Apple. For unfortunately, it's not ready yet. For Android, it will be in about a year. And it's already having some really great results and feedback for kids. They were just telling me about a child that had horrible neuropathy from his treatments, and it had already helped him make progress with that. So welcome back to the show, ladies.
Thank you. Thanks.
Yeah, so, okay. There's a lot going on this year and coming up for you with this project, hashtag Kids Cancer Pain. Could you walk us through some of the next steps and some of the goals that you're trying to accomplish with it?
Sure. So really this project is a real a partnership between so many different groups and stakeholders. Obviously, it's a partnership amongst researchers. So Dr. Stinson and I are the leads, but we have a group of oncologists and experts in communication and e-health as part of the research team. We're also partnering with this Cancer Knowledge Network. They've been phenomenal, excellent online resource, and they are really taking our science and translating it into blogs and other social media content that are accessible to families. Parents play a big role, not just in being the target audience for this campaign, but also in shaping the campaign. So we have a very significant patient engagement component where we have a panel of parents from across North America, who have been helping to guide us, who have informed us about the topics that they want to have covered, what they need to learn about, what would have been helpful to them. They provide feedback, just like the research team does, on every bit of content before it goes live. So the parent perspective is totally interwoven into the project. And then also we have a number of cancer advocacy groups and supporters who are helping inform and spread the campaign, because social media is all about sharing and commenting and spreading. And so really it's a very exciting kind of team effort, and certainly we're hoping that together we can accomplish more than we could simply on our own as researchers. And over the course of the year, in response to the parents' feedback, we're covering a whole range of topics. We're covering, sources of pain, pain assessment, pharmacological pain management, also, non-pharmacological, psychological, physical strategies. We're talking about chronic pain in cancer survivors, as well as pain at end of life. So a whole range of topics. And Jen Stinson just went over her app, which is incredible. And I mean, she deserves a total shout out for taking a step that researchers don't often do. I mean, researchers are supposed to get grants and publish papers, and Jen certainly does plenty of that. But actually making a research-based tool available to families in an accessible, free way is pretty much unheard of. So the challenge then, though, becomes how do we let parents know about it? So, that is just one example of the kinds of content content that we're covering. And we're doing it across social media platforms. So there's blogs on the website, there's tweets. Just today, we released our second Facebook poll. So if you go on Facebook and you search the hashtag Kids Cancer Pain, you're going to find the poll that was released today. And it simply asks parents, of the procedures your child has had, which one was the most painful? And parents actually have an opportunity to win a prize for engaging with the content, and they have a week to help get a discussion going, because really that's what social media is about. It's about sharing evidence, but doing it in an interactive way.
If it weren't for social media, people would be, oh my goodness, it has just opened things up for families, because so often just having a certain diagnosis is isolating. Yep. You're often made to feel very alone, and it's not so powerful anymore with all these wonderful tools that are coming out. And I can't thank you enough for bringing it to our attention today. So if there's a parent out there right now listening and their child is really struggling, what can they do?
Well, certainly they can. I mean, they should talk to their health professional. That's a very important thing to do. Right. And so we're not, taking the place of the healthcare team at all. But what we're doing is trying to provide, information that can be trusted, and putting it where parents are already going, and, ensuring that when parents do Google about their child's health, and they're going to, of course they're going to. A lot of health professionals will say, don't Google this. Of course they're going to. That's not realistic anymore. So the issue then becomes, when they do Google or do search, what are they going to find? And we are trying to make sure that parents find good, solid, evidence-based content that they can be linked and supported in a way that's helpful to them.
Excellent. So you're really providing trusted information that helps families improve really the overall experience that their child is having as they, as we run through the maze, right?
Exactly.
Wow. So what's the next step with this?
Well, really, we're sort of just a few months in. We launched in July, and the next step is our job is to be responsive to parents' needs, continue to create solid content, blogs, social media. We will also be having a Twitter chat at the 6-month mark where parents can hop online over an hour-long period using the hashtag Kids Cancer Pain and ask their questions and have the scientists and the health professionals on the team actually answer them live. So we have a lot to look forward to this year in terms of content to share. And then, of course, at the end, we'll be evaluating, as we discussed before, the reach and the impact, which we hope will be significant.
Great. So we're going to be asking people to share on this show. Share the information. Use it. And, just so people know also, if you are listening live, this show in about an hour, sometimes 2, depending on me, how quick I am. We get it out there so people can download it and share. It's time to take a quick break for commercial messages from our sponsors at TogiNet.com. I'm Janet Demeter, your host for Childhood Cancer Talk Radio, and we have the unique opportunity today to visit with Dr. Christine Chambers at the Center for Pediatric Pain Research at IWK Health Center in Halifax, Nova Scotia, and Dr. Jennifer Stinson, coming to us from the Hospital for Sick Children in Toronto, Ontario, Canada, where they're collaborating on Kids Cancer Pain Project right here on Childhood Cancer Talk Radio. We'll be right back.
Stay tuned. Janet will be right back with more on Childhood Cancer Talk Radio, where kids come first for the cure.
Ever get nervous riding in an elevator because you're afraid the cable might snap? It's entered my mind more than once. According to Elevator World magazine, on the rare occasion a cable breaks, the car won't plunge to the bottom. This is because elevators have as many as 10 cables holding them up, each capable of supporting a fully loaded car. Sometimes I feel a little mischievous in elevators. Next time you're feeling like a rapscallion, try one of these little jokes. When there's only one other person in the elevator, tap them on the shoulder and then pretend it wasn't you. Push one of the buttons and pretend it gave you a shock. Or maybe start a sing-along. What's a word for a person who thinks he's funny but no one else does? Witzelsucht.
It's words you never heard.
I'm Carolyn Davidson, and you can have fun challenging your words you never heard vocabulary with my free app, Too Funny for Words.
Have you heard? The pages of American Patchwork and Quilting magazine come to life on our new weekly online radio show, American Patchwork and Quilting. Join Pat Sloan, our blogging and quilt designer host, as she talks about the latest trends, ideas, and inspirations. Her guests include quilt pattern designers, authors, quilt shop owners, and our editors, all quilters, just like you. Call in with your questions. Get quilting tips from industry experts. Learn about free patterns. Hear behind-the-scenes stories from our magazines, American Patchwork and Quilting, Quilt Sampler, and Quilts and More. Get the scoop on free stuff and find out more about the best independent quilt shops in North America. To listen to a live show, tune in Monday at 4 p.m. Eastern. Just log on to allpeoplequilt.com/radio. To hear past shows, go to iTunes and search for American Patchwork and Quilting Radio. We hope you'll join us because we know that quilting changes everything.
Welcome back to more great conversation on Childhood Cancer Talk Radio, because every child's life deserves hope. Here's Janet.
And we're back. You're listening to our conversation today with two amazing ladies from Canada, different regions. Dr. Christine Chambers is at the Center for Pediatric Pain Research at the IWK Health Center in Halifax, Nova Scotia, and also Dr. Jennifer Stinson coming to us from the Hospital for Sick Children in Toronto, Ontario, Canada, collaborating together on the hashtag Kids Cancer Pain Project. And we're live right here on Childhood Cancer Talk Radio today. For more information about this project, go to the Kids Cancer Pain website at cancerkn.com/Kids Cancer Pain. I just have to tell our listeners also, I'm so grateful for this information for all of our listeners, because, not so long ago, just a few years ago, before social media, it's been making explosions over the past 10 or 15 years, but really over the last 5, I'm just going to relay a little bit of my own experience. My child had a DIPG, which, is a pretty bad pediatric brain tumor. It's hard to find survivors. Let me just put it that way. And they don't have a lot of time as they come in. And so it's all about quality of life, right? Quality of life and doing whatever you can without knowing a whole heck of a lot, at the end, to make them comfortable and have the best possible experience and make memories and all that. It's so hard. And I'm telling you, I wish I had, I really wish I had this kind of a supportive program at that time where, okay, first of all, we have an app by Dr. Stinson called the Pain Squad that helps the child by asking, wow, amount of pain, where's the pain, what do you think's causing it? Immediate delivery of a PDF to the doctor about what's going on. That's amazing right in and of itself. But just having this network of support, with this Kids Cancer Pain Network is amazing too. We had this situation at the end where Jack was having a hard time, and the palliative care team thought that this particular drug would help him, that he might be being psychotic on his steroids, and he wasn't, and the drug really didn't have a very good effect. And we were all alone. We were at Disneyland, and he didn't have a really good time. It was really sad. And I'm just thinking, oh my gosh, if we had had something like this, we might have been able to turn it around a little bit, because we didn't have a lot of time. But tell us what you know about any of the folks who have used this program so far, started using it, that are in an end-of-life situation. Have you had something like that yet that's prominent in your minds?
Yeah, it's definitely been a strong message that we've had from parents that is so salient. And in our first blog that Jen Stinson and I wrote to kind of launch the campaign, we had a quote from a parent who simply said, their child had passed away a number of years ago, but the pain memories are the worst.
Yeah.
And so I think, that has really impacted me, and so many of the parents on our parent panel are have had the same experiences that you have had, Janet. And, what more compelling reason do we need to make sure that the research that we have that could help families actually gets to them?
Yes.
So, and we'll be tackling and these are not easy topics to tackle. And it's a very fine balance between, social media. Often people think of it as kind of fun. And these are deep, emotional, powerful issues. But I think using the power of social media to connect people. And I was just noticing, I got a note that we had our first parent respond to the Facebook poll that just went live about an hour ago.
Yay!
Yeah. So maybe that's one of your listeners. Thank you. These are the kinds of important discussions that we need to have, and, linking parents with other parents, but with also, health professionals, scientists working together, we can do a lot more.
Absolutely. It's all about, you can't letting it get you down and put you in a corner. That's the most difficult part of the whole experience of a child diagnosed with cancer. And also, chronic illness, the pain. There's so many other, things that go on for kids that, with disease that are especially difficult. And my heart goes out to all of you, and I thank you, because this is why we're on the air. We want to help promote programs like this that improve people's experience. It's the only reason, as I tell everyone pretty much every time I raise awareness for DIPG, is because I don't want no one should hear that their child's life may not be as important as, enough in numbers for research investors, things in the system, it's pretty much across the board, but, our medical research system and how we treat people has to be for the people first. And that's always people's intentions. But in a system that needs some change, it isn't always coming first. And that's what reaching out, communicating, and being supportive to one another can really help change in a very striking way.
Absolutely.
Jennifer, with the app, I wanted to know, what was your inspiration for this?
I think it was really my working with young people with cancer and their difficulty wanting to talk about their pain and communicating with healthcare providers. They talked about how difficult it was. So I really wanted to harness the power of technologies, which these kids all use. They all have cell phones, to try and come up with something that would be fun and engaging. And the other thing with cancer pain is that I was concerned kids wouldn't want to use the app because they're feeling unwell, they might be fatigued or nauseated. And so within this app, when you check it out, we sort of gamified it to make it fun for young people with cancer to complete. So they could start out as a rookie in a police force, and as they kept doing entries, they could become the chief of the police squad. And we had inspiring videos from actors in two of Canada's top police dramas, dedicate their time to help us make these inspiring videos within the app. And so it was really seeing how this tool could help young people better feel like they were in control of managing their pain and communicating better with healthcare providers.
I love that. That's great. That's awesome. Oh my gosh. Take note, people, all you techies out there. This is awesome. Jennifer, did you have any experience earlier in your life with a child who had cancer that was very, very close to you? Or has this been sort of something that you've come upon that's moved you from a professional standpoint and something you've come into that way?
Yeah, so as a nurse, when I first started out, I guess I struggled a lot with knowing what I learned in class about how to assess pain and manage it. And when I was started off as a staff nurse, I realized that we're not taking this knowledge and using it in everyday practice. People were not assessing pain in children. We are not using the strategies that we know in terms of providing medications when kids are undergoing painful procedures. We're not using psychological interventions. And that was the real motive that made me go back to get more training and research so that I could really take a lead in sort of developing novel interventions to help young people manage pain, whether it's due to cancer or chronic pain or some other chronic condition. But I'm particularly interested in helping young people with cancer in terms of managing both procedural but more chronic pain as well.
That's great. And with the app also, I had a question. It's obviously an international app. Are there different modes or uses for different regions of the world, or how does that work? Just tech speaking.
Yeah, so right now it's available in North America, but I've actually been reaching out with collaborators in Africa and also China to culturally adapt the app and translate it into different languages to make it more available worldwide.
Wow. And Christine, Dr. Chambers, because we are getting close to the end here, I wanted to ask you, I know you have 4 children, and thank goodness, I hope they're all healthy.
They are. They've had their fair share of hospitalizations, and one of my children's had a chronic condition, but for the most part, they are.
That's so wonderful. And so was there a special case earlier on in your life that inspired you to help children with cancer or chronic illness?
I think really it's just my interest in supporting parents in general. I mean, parenting and being a parent is the hardest job. I mean, I often say it's the hardest, most wonderful thing you'll do, and it's both of those things. And when you layer on a medical condition or a devastating diagnosis, it's even harder. And so my motivation really is how can we use science to help parents and help their children, and, by collaborating with people like Jen Stinson and all the other amazing people, the Cancer Knowledge Network, I feel like we're doing that. And it's all about empowerment. And certainly, health professionals have a very important role to play in ensuring kids get good pain management. But parents are more a partner in their children's health care than they ever have been. And we just want to get them the information and the opportunity to be able to be the most effective.
Well, absolutely needed. You're helping, not only is it your passion for helping parents, but you're helping parents deal with the unthinkable, things that most people don't want to think about. So again, thank you so much for what you're doing. And please, in this last minute here, push this hashtag, hashtag kids cancer pain. Right?
Absolutely.
And the www.cancerkn.com/kids cancer pain, the Cancer Knowledge Network, right?
That's it.
Okay, perfect. We here in the United States salute you in Canada and thank you so much for your collaboration, because I look to the Cancer Knowledge Network. We've had Jonathan Agan on here several times. He's a wonderful advocate, and thank you again so much for coming on. That's all the time we have. I hope you'll come back and update us.
We would love to. Yeah, that would be wonderful.
Thank you, ladies, so much. And don't forget, CAC2.org. Their research is coming up.
We hope you have found inspiration from today's show. For more about Janet Demeter and her mission, visit jacksangels.org. As founder and president, Janet strives to assure that children with cancer and their parents have a voice,